PKU at the moment, we require a handheld monitoring device would be fantastic. I think there's about 7 in development worldwide. And this would make sure that we receive blood levels so we can respond quite quickly. We need to be cautious of these new devices, as I've mentioned earlier, because it can lead to what we call helicopter parenting perhaps, or people who are driven by fear and over monitoring. So that can be an issue. We have other issues in our community around inaccurate labeling and in a misleading labeling of both phenylalanine and protein. So protein is something that's not regulated well at European level, and that drifts down to each individual country. So we have different systems in each country and how we actually calculate phenylalanine as well. So we need a universal system. Professor Anita MacDonald in Birmingham Children's Hospital has done a lot of work in this area, which has been fantastic. So there's now a PKU handbook that describes how to manage the diet that's available free online to download for metabolic centres all over the world. Some countries struggle to actually access medical treatment. So in the United States, for instance, as progressive as a country it is, they are trying to get medical foods available to all patients. It really is dependent on the insurance, the health insurance policy that you have available. In other countries, we have different levels of access to products, both medical drinks and medical foods as well. So yes, there are issues for some families to access these treatments. With regard to adult care, we need to understand that phenylalanine is the biomarker that we're currently using. However, research has shown that there may be other biomarkers that are more closely associated with neurocognitive outcomes that are stronger than phenylalanine alone, as demonstrated by Dr. Van Wangberg, which was N-lactol. Phenylalanine is one of those such biomarkers. In the USA, the optimum phenylalanine levels for PKU are 120 to 360 micromoles per litre. In Europe, it's 120 to 600 micromoles per litre, and this is for anybody over the age of 12. So in Europe, they take quality of life studies into account, and the thought behind that is that adult patients will be more adherent to dietary therapy. Unfortunately, from the scientific point of view, as Dr. Jerry Vockley has presented on the USA side, it has shown that the optimum levels are a lot less. So there's still a lot of research around the only controllable that we have for PKU, and that is phenylalanine.